Should women begin cervical cancer screenings at 21? Many women wonder when they should start getting screened for cervical cancer. The answer is based on careful scientific research and recommendations from major health organizations. According to the U.S. Preventive Services Task Force, the American Cancer Society, the Centers for Disease Control and Prevention, and the American College of Obstetricians and Gynecologists, women should begin cervical cancer screening at age 21. This guidance is supported by extensive studies showing that early screening helps detect precancerous changes before they develop into invasive cancer, saving lives. For women aged 21 to 29, the standard approach is to have a Pap test every 3 years if previous results are normal. The Pap test involves collecting cells from the cervix to look for abnormal changes. Even if a woman is sexually active before age 21, screening is not recommended until she reaches this age. Some guidelines suggest that HPV testing, which looks for high-risk human papillomavirus types linked to cervical cancer, can be considered for women aged 25 to 29. However, Pap tests remains the primary screening method for this age group. Once women turn 30, screening options expand. They can choose to have a Pap test alone every 3 years, an HPV test every 5 years, or a combination of both tests every 5 years. The American Cancer Society now recommends starting screening at age 25 with HPV testing every 5 years, but the traditional methods are still acceptable. These guidelines are designed to balance early detection with minimizing unnecessary procedures. The reason for starting screening at age 21 is rooted in understanding how cervical cancer develops. It usually takes many years for precancerous changes to turn into cancer. Screening at age 21 allows for early detection of these changes, which can then be treated before they become more serious. This approach has been shown to significantly lower the rates of cervical cancer and related deaths. It's important to remember that HPV vaccination does not protect against all high-risk HPV types. Even women who have been vaccinated should follow screening recommendations. For women over 65 who have had consistent normal results, screening is generally no longer necessary. Women who have had a hysterectomy removing the cervix and no history of high-grade precancerous lesions also do not need screening. When preparing for a Pap test, women should avoid douching, vaginal medicines, or spermicides 4 to 2 days before the test to ensure accurate results. HPV testing requires no special preparation and can be done during menstruation without affecting accuracy. Regular screening is a vital part of reproductive health, helping detect early changes that can be treated easily and preserving fertility. In summary, starting cervical cancer screening at age 21 is a well-supported, evidence-based practice that helps protect women's long-term health. It's always best to discuss personal health history and screening schedules with a healthcare provider to ensure the most appropriate care. Remember, early detection saves lives, and staying up to date with screenings is a key step in maintaining reproductive health and overall well-being.